And Russia has begun voluntary COVID-19 vaccinations. The country's President Vladimir Putin announced the move on Wednesday. It comes after Russia said last month that its domestically produced Sputnik V vaccine was 92% effective. Let's get an update now from our correspondent in Moscow, Julia Chapman, joining us live now. So, Julia, this is today, Saturday, the official but not so official start of vaccinations because thousands more people had already been given this vaccine. Is that right?
Yes, that's right. Officially, the vaccine rollout gets underway from today. Unofficially, it's already been going on for a few months now, alongside phase 3 of the clinical trials of Sputnik V. And of course, Russia has been rushing the process by some accounts already, and there has been a lot of criticism of the way that they've handled the process. They registered the vaccine back in August before phase 3 even got underway. And then alongside the trial, they've already been vaccinating some doctors, medical workers and teachers. As of today, however, there are now 70 vaccination points only in the capital, Moscow, where those workers can now sign up to come and get their free vaccination. They've slightly widened the criteria as well to include some public-facing government workers who can now also be inoculated. But they all have to be under the age of 60 and have no underlying health conditions. So there are still quite a lot of restrictions on eligibility, and it's not yet a full public widespread rollout of the vaccination yet. Nevertheless, President Vladimir Putin did say that he wanted mass vaccination to get underway in the next week. And of course, that comes as the UK has given regulatory approval to the Pfizer-BioNTech vaccine, which will start being used next week over there. So there's certainly something of a competition. Nevertheless, Russian developers of the vaccine say that theirs is safe and effective and ready to be used.
And interesting, of course, that these jabs are now being given to teachers, social workers and doctors who are under the age of 60 in relatively good health instead of those who are in hospital, because Russia has already recorded upward of 2 million infections and over 40,000 deaths. Why is that?
Yes, that's right. In fact, today Russia recorded its record number of daily COVID-19 cases. More than 28,000 were recorded in the past 24 hours. Some 8,000 of them were here in Moscow, the center of the outbreak, the worst hit city. And of course, there are hospitals filling up all around the country, many of them very much nearing capacity. But of course, the vaccine isn't fully ready for widespread use. Phase 3 of the clinical trials hasn't yet come to an end. That's still ongoing. We have received some preliminary data from the developers kind of indicating how safe it is, what the side effects have been in the 45,000 people who took part in clinical trials. But it's not quite at the phase where it's ready to be declared over and ready for use for the entire population of Russia. But we are expecting that to happen in the next couple of weeks.
What is the level then of public trust in these vaccinations, given the controversy about the steps followed in getting to this point?
That's right, there have been a lot of questions raised, but actually polling suggests that an overwhelming majority of Russians would prefer to take a domestically developed vaccine. And there were fears that, of course, rushing the process of developing COVID-19 vaccines, not just here in Russia, but anywhere in the world, could undermine trust in the vaccination process as a whole. And, of course, the anti-vax movement does have some roots here in Russia. There are certainly issues with that. But of the people who say that they want to be vaccinated against coronavirus, and it will be voluntary here in Russia, nobody is being made to be vaccinated. They say they would prefer to take Sputnik V. They say they have faith in the Russian developers of this vaccine. And indeed, the Russian developers say that there is a history in Russia of producing similar style vaccinations using viral vectors, the kind of method that brings the virus, small traces of the virus, into the human body. And they say that their method is proven and well tested and it can be applied to COVID-19, and which is why they are really backing this method of vaccination here in Russia.
So with upward of 2.3 million infections again and over 40,000 deaths, do Russians just generally believe that the government of President Vladimir Putin has been on top of things as far as its handling of the pandemic there?
There has certainly been some criticism, although most of it was earlier in the year when we went into a full nationwide, what they called a non-working period. The word lockdown wasn't really used apart from in individual cities like here in Moscow, but the entire country basically stopped working for the month of April, and there was a lot of criticism that there wasn't enough government support. But ever since we've come out of that non-working period, lockdowns have been lifted. There hasn't really been so much criticism, and this time around we are of course fully in the second wave now of Russia's coronavirus outbreak. The government has now instead preferred to delegate the restrictions against COVID-19 based on the regions, so it's up to the regional leaders how strict they want to get, and so it's not necessarily being seen as the role of the central government to decide. And broadly speaking, most Russians seem to be in support of lighter measures, and the approach that the government seems to be taking really here is that they want to get the population vaccinated as soon as possible so that they don't need to do any more damage to the economy.
Julia Chapman, our correspondent in Moscow, Russia. Thank you so much for that update, Julia.